Good morning, students. I welcome you to the lecture of this morning. We are starting with a PC 2011, and that is an introduction to public health. It focuses on the concepts of health and public health and traces the history of public health care from the earliest times to the modern time. While we engage this lecture, these are the objectives that we're going to make sure our talk and whatever we do today revolve around. So the lecture is designed to teach the learner to conceptualize and operationalize health and public health and their mission. To conceptualize means to just give a definition, and to operationalize means to give a working definition. It means to give a definition that is measurable. Number two, this lecture is also designed to teach the learner to explore the dimensions and determinants of health. There are dimensions of health and there are factors that affect health. During this lecture, we're going to learn how to explore the dimensions and determinants of health. And number three, the lecture is also designed to teach the learner how to distinguish between clinical health and public health care. And last but not the least, the lecture is designed to trace the history of public health from the earliest times to the modern time. Now, let's conceptualize health. Our conceptual definition of health is given by the World Health Organization. And this conceptual definition of health was given in 1948. But before then, we know that the word health is widely used in public communication, but the meaning looks simple. Everybody talks about health. However, when we take a closer look at the word health, we discover various and diverse meanings. From the lay point of view, persons who are healthy or who are considered healthy by many lay people are people who are able to carry out their daily activities with no apparent symptoms of disease in them. And even the Oxford Dictionary of English describes health as the state of being free from illness or injury. But if you want to look at it from a professional point of view, we can look at health, or we can conceptualize health, or we can define health as a measure of the state of the physical bodily organs and the ability of the body as a whole to function. Meaning we are looking at health from the functional perspective and from the structural perspective. And we are also talking about the freedom from medically defined diseases, so that you can find someone when he doesn't feel sick, he can tell everyone, I am healthy. I'm a healthy young man. I'm a healthy young woman. I am not sick. I have no disease. But looking at the definition that WHO proffered in 1948, which conceptualizes health as a state of complete physical, mental, and social well-being are not merely the absence of disease or infirmity. We understand that the definition of health, or the kind of definition we should have of health, should go beyond the kind of definition that a layman would give, or a kind of definition that we feel that people who are trained in the areas of health may give. The problem with the professional definition of health is that it is a little medicalized, because they were looking at health from the point of view of medical illnesses and diseases. But this one that is given, or that was given by the World Health Organization, that looks at health in 3 dimensions, comes close to what we should be looking at health as. So again, the World Health Organization looks at health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Many keywords are coming out there. The first one is the state. The second one are the dimensions, the physical, mental, and social, and then the well-being is there. And last but not the least, we have not merely the absence of disease or infirmity, which is a key phrase in that definition. This definition has come under various attacks. Many authorities have argued against it, because some have argued that health is not a state. And those who argue in that respect look at health as a continuum, so that because a state gives a feeling of something being absolute. It gives that sense of being absolute, and they are saying health is not absolute, that it should be a continuum, that people can be at a particular level of health at a particular point in time. Some other persons have also looked at the dimensions and have said, no, we can't just have physical, mental, and social well-being. What about the other dimensions of health? Why are we not talking about emotional health here, which is very important to our everyday living? Why are we talking about the spiritual health here? People have argued against this definition. But according to the World Health Organization, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. Like we have heard about the rights of a human being. We have the right to life, the right to live freely, and the other rights. What we are saying in health is that to enjoy health without any distinction of race, your race, of your religion, of your political affiliation or belief, of your economic situation, or of your social condition, should be the right of everyone. Because of the arguments that have been made against this conceptual definition of health, recently the statement of the definition given by WHO has been expanded by some authorities, and it now includes the ability to lead a socially and economically productive life. Now, the World Health Organization itself, with its functionaries and organs, also had to go back. They had to go back inside. They had to go back to the working table, the working bench, to proffer a working definition for health, in order to overcome the lacuna that the earlier definition gave. And now we can look at health as a condition or quality of the human organism, expressing the adequate functioning of the organism in given conditions, genetic or environmental. This is given because this can be measured. The problem with the first one is that it cannot be measured. You can't really measure, a state of complete physical, mental, and social well-being. When do we say a man is physically healthy? When do we say a man is socially healthy? But this working definition gives a way to measure those areas, a condition or quality of the human organism expressing the adequate functioning. So at that functional level, we can measure health at that. We can send someone to go for a renal function test to look at the integrity of the kidneys and their functioning. We can send someone to go for a liver function test. Someone can go for echocardiogram or even electrocardiogram to see how the heart is functioning, to see how the electrical activities of the heart are going. We can send someone to check their blood sample for the presence of or absence of parasites or of other microorganisms that can cause disease. So this is measurable. This is a working definition. Health is a condition or quality of the human organism expressing the adequate functioning of the organism in given conditions. And those conditions may be genetic, may be inherent, they may be inborn, they may be in the gene, expressed in the gene, or they may be environmental, they may be external, they may be coming from the ecology of the human being. Now, let's look at the dimensions of health. What are the dimensions of health? Like we mentioned earlier, there were criticisms against the earlier definition of the World Health Organization because the dimensions were very few. The definition by the WHO, the conceptualization of health by the WHO only talked about the physical, mental, and social well-being. But now we see that there are 5 major dimensions of health. So that if we want to measure health and we take a look at those 5 dimensions, we can say categorically that the individual that has the attributes is healthy, or we can declare the individual not healthy based on their performances vis-a-vis the 5 dimensions of health. What are they? The first one is physical health. And physical health talks about anatomical and physiological integrity. It talks about the structure of the body and the functioning of the body. It means the ability to perform routine tasks without any physical restriction. You see, that means there is the need for physical fitness for one to be able to walk, for one to be able to play, for one to be able to even rest. So the physical health dimension looks at health from the physical perspective. And what is the physical perspective? We talk about the anatomical integrity of the body, and we talk about the physiological disposition of the body. Anatomical, talking about structure. You're talking about the muscles, you're talking about the skeletal structure, you're talking about what you can see, you're talking about the ability of the body to maintain that integrity. And then physiological, talking about the functioning, ability to move our hands, ability to bend down when we ought to, ability to stand up when we ought to, and the other functions of the body. Then we have the mental health, which is the ability to learn and think clearly and coherently. This is measurable. The ability of an individual to learn. This person is not dyslexic. He doesn't lack the ability to learn and the ability to have a sound mind, to think clearly. Now, that tells us someone who is dyslexic has mental impairment. It tells us someone who is mentally deranged has mental impairment because that individual lacks the ability to think clearly and coherently. So a person who is not mentally fit or who is mentally retarded, like people who are mongoloids, people who are mentally deranged, they cannot learn from something new at a pace in which an ordinary, normal person learns. And that is what it means. So that the mental health has to do with our ability to learn and think clearly and coherently. The next one is social health, which is the ability to make certain acceptable interactions with other people. Acceptable interactions. It also includes our ability to enter into a relationship and to maintain the relationship. Family health comes under this. Family health, the health of your relationship with friends, with colleagues, with acquaintances. Now, we have to talk about social health as a dimension of health because it affects a lot of a lot of ideals that bear on health. Think about a person who is not able to make or maintain acceptable interaction. I brought that word acceptable there. For instance, that someone may be relating to others, but the interaction may not be acceptable. It's always harsh. When they talk to him, he talks back in a harsh tone, and the other person is surprised, and the other person is asking, "Are we quarreling? What is going on?" That is not an acceptable way. So the person who is involved in that kind of discourse may not be socially healthy. Now, it includes our ability to celebrate during festivals. There's festival going on, and someone is sitting at a corner, or someone is looking mournful. Something is wrong. Or a family member is late, and someone is by the side making some merriments. It includes our ability to celebrate during festivals and our ability to mourn when a close person dies, and even to mourn with those that mourn. Our ability to create and maintain friendship and intimacy. The social dimension of health talks about that. And then the next one is emotional health, which is the ability of expressing emotions in the appropriate way. I said appropriate because there are times people express emotions, but they express them in an inappropriate way. Imagine coming to a burial ceremony and someone is laughing, and another person is wondering, what is funny? Someone is dead. You should be mourning with people who are mourning, and the person is laughing. Or you come to a place where people are having merriment, and everybody expects everyone to be happy, and then someone is crying at the place of merriment. The ability to express emotions in the appropriate way. In fact, it includes the ability to even fear. There's fear going on. The ability to have that fear, to be afraid of something, is okay. The ability to be happy, when there is a need to be happy, the ability to be annoyed, to be angry, when there's a need to be angry, those are all included in the emotional dimension of health. The response of the body should be congruent with that of the stimuli. You can't just have a stimulus is going on. The stimulus is the stimulus of merriment, and you are expressing the emotion of sadness, or there is the stimulus of sadness going on. There is a dirge being sung because someone passed on, and then you are having the emotion of happiness and joy. No. So emotional health is related to mental health, and it includes feelings. So there is the need for the emotionally healthy person to maintain their own integrity in the presence of stressful situation. Maybe there's tension, or there's depression, or there is anxiety. And the last dimension we are going to talk about today is spiritual health. And some persons relate spiritual health to religion, and rightly so. For others who are religious, or those who are atheists, it has to do with personal values. But for people who have religion, they relate spiritual health to the ability to worship, the ability to read the holy book of the religion and meditate on it, the ability to communicate with the supernatural being that is being venerated or worshipped in the religion. But plus that, we also have this other aspect which people who are religious or are atheists also have, which has to do with personal values. What are your values? Personal beliefs. What is your belief system? What are your beliefs? What do you believe in? Or it also has to do with personal principles and ways of achieving personal and mental satisfaction, and they are all related to spiritual health. So those are the dimensions of health. Now let's come to what we really want to talk about today, and that is public health. Now, close to a century ago, there was a man called Charles Edward Amory Winslow. That man was a living figure in the development of the modern study of public health. So we can even refer to him in the present tense that he is a leading figure in the development of the modern study of public health. And the definition that he gave of public health, he gave it almost a century ago, almost 100 years ago. But the definition is still relevant to us today. And that is the definition displayed here. That public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. When we look at this definition, we see the key words that are standing out. Number one, there is a science and it's an art. As we go on in the introduction to public health, we're going to look at the core sciences that are basic to the operation, to the principles and practice of public health. So it is a science because it follows scientific procedures in order to elicit the functions or to elicit the interventions that it gives to society. But it is also an art. It's an art. And then other things that are standing out are that there is a touch on at the broader societal, you see there, and community levels. Even when you look at it, you still see individual levels. Take note of that. The influences of the public health interventions or the public health programs, the influences are felt at the broader societal, community, and the individual level. We're going to talk about those later. So, what is the mission of public health? Public health aims to provide maximum benefit for the largest number of people. Don't forget that. Maximum benefit. Later in the lecture, we're going to talk about the focus of public health, and that is when you understand the mission very well. We're talking about providing maximum benefits for the largest number of people. We're not just talking about an individual. We're not just talking about maybe just two persons, but the largest number of people. Now, let us trace the history of public health before we go back to some other things we need to talk about today. Now, when we want to take a look at the history of public health, we look at them through some lenses, and we're going to look at them through 4 lenses. And these 4 lenses we're going to look at them through, they are examples of how public health has worked to contain infectious disease through different ways, infectious, non-infectious disease, and all that. There are 4 areas in order to trace the history of public health. Now, the first one is sanitation and environmental health. The first area we want to look at to see what public health has done over the years in order to contain infectious diseases. What public health has done over the years in order to control diseases. There are 4 examples we're going to look at here, and we are also going to have you add your own history, the history, how it happened in your own country, as the last one. That is why you have the history in your own country. The first one is 1,500 years before Christ. And we're talking about the biblical book of Leviticus. The book of Leviticus, if you take a look at it, we are looking at it because this is among the earliest records of sanitation and environmental health that we have on record. The book of Leviticus has guidelines for personal cleanliness. You're talking about when someone wants to ease themselves, when someone wants to go to the toilet, what you should do, how you should go with a spade, what you should do when someone becomes leprous, what should be done with a person. It has guidelines on personal cleanliness, what one should do if one has had a particular issue, like the King James version of the Bible says, from the body, what the person should do. If one has bled, what the person should do. If one has gone to touch the carcass of an animal, what one should do. And then there's the sanitation of campsites. Oh, this is our campsite. This is our tent of meeting. This is where we dwell. This is where we live. How should we clear the surroundings? They are there in the book of Leviticus. And then the disinfection of wells. You have a well, you are suspecting there is death in the well. Maybe there is an infectious agent in the well. What should be done there? And even isolation of lepers, like I mentioned before, and disposal of refugees, and even the hygiene of maternity. They are all there. So as far back as 1,500 years before Christ, we have guidelines that we can refer to today as guidelines on sanitation and environmental health. And the second one is about 500 years before Christ. From history, we know that the ancient Greeks and Romans actively practiced community sanitation measures. Now, as we talk about these old years, the years we are mentioning, what comes to your mind? What should come to your mind is that environmental health or sanitation or the practice of public health as a whole is as old as human civilization. And then after that 500 BC, we have something in 1848. That's about approximately, let me just say many years later, there was the development of the Public Health Act of 1848. And that was when it was established. That Public Health Act was established in Britain, in the United Kingdom, and it provided a central board for health. Let's have a board, let's have people responsible for health in this area. And it also placed responsibility for sanitation in the hands of borough. People were designated, and then entities were designated. You are in charge of sanitation. Make sure the environment is clean. We don't want anybody defecating around. We don't want anybody defecating near our source of domestic water supply. Everybody stay away, and let's make sure the surroundings are clean. Let's cut the bushes. Let's get standing water out of the way. That was done. And in 1970, in the US, the Environmental Protection Agency was established. And that was in the US. That Environmental Protection Agency protects human health by safeguarding air, water, and land. If you look at those three elements, air, water, and land, those are the dimensions of environmental health. Those are the places where we need to take sanitation to. And last but not the least, you should be thinking now, what is the history of sanitation and environmental health in your country? I know that in Africa, many governments have set up bodies that are responsible for taking care of sanitation, of the environment, of communities, and even of this waste disposal and of environmental health generally. And different regions and districts and countries have their own. I want you to begin to think about that as we round up the lecture of today, or when we are done with the lecture of today, you need to sit your own and take a look at the history of your country, and in your state, in your region, in your district, and put some things down. Think about it. What is the history of sanitation and environmental health in the place where I live? The second lens that I want to look at is the history of pandemics. There have been many pandemics in the world. That is another lens through which we are looking at how public health has helped over the years. The lens of pandemics. Now, pandemics are epidemics or outbreaks of disease that spread far and wide, affecting the populations of multiple continents. That is what we call pandemics. The first one there is the Spanish flu. There was what's called the Spanish flu, which infected 500 million people across the world, including remote Pacific islands. And I think of remote Pacific islands like after Hawaii, the United States, when you go to the other islands in the midst of the Pacific Ocean. Those are the furthest places on earth. But there was the Spanish flu, which infected 500 million people. That is 500 million people around the world or across the world, including those remote places, and even in the Arctic region, in places where you have only glaciers, people who are, in colloquial terms, living on ice block. They're just living in snow, and it got there. And that pandemic killed 20 to 50 million persons. And you remember there was this particular flu. Before I go ahead, this particular flu we're talking about, if you look, I think it was in 1918. You take a look at some of the pictures, you see that people were wearing masks and they were even what were wearing masks and they were, so those things happened, and that was far away in 1980. What about biological weapons? Now, a very good example of the use of biological weapons was the one that happened in the 14th century AD, when which is called the Siege of Kaffa. The Siege of Kaffa. The attacking Tatar forces used plague as a weapon of war. They were hauling plague-infected corpses into the enemy city, and their actions started the first stage of the Black Death or plague among Europeans. After the 9/11 saga in the US, we remember there was this scare about anthrax. They say, oh, somebody posted a letter, they looked at the letter and discovered that there was anthrax. And there was this scare about the use of biological weapons. So biological weapons have been used down the lines, and public health measures were able to arrest them. If you look at the September 11, 2001, we talked about in the US, during the attack on the World Trade Center, it took public health people to come on the scene. They were on ground at the World Trade Center after the attack, and they were conducting surveillance to identify outbreaks of diseases or other possible health conditions resulting from the attacks. In fact, public health workers monitored closely the health of these first responders, those who went there to rescue the people, and even the city residents. And then they were also trying to detect anything that may be inimical to the health of the people from environmental conditions, even right during the attack and during cleanup. And then we have had a lot of hurricanes. A hurricane just went through the Philippines. If you get there, you will know that in the aftermath of the hurricane, a lot of things happened, there was flooding everywhere. So it took public health officials on ground to take a look and assess the situation, to survey what is going on there, and to advise the public appropriately. And that also included re-engineering the environment so that people will not just be walking into deaths in which that they are not aware of. And it also includes providing some necessities for the people to protect them from cold, to protect them from the direct impact of the flooding, and also protecting the waterways or the paths to domestic water supply in the city so it doesn't get contaminated and bring about an epidemic. We have had a lot of earthquakes around the world, you know. During those earthquakes, public health officials surveyed the situation and spoke with authorities about the possible health impact of the disaster, and advised appropriately. We've had a lot of volcanic eruptions and tsunamis. You remember the latest tsunami and the challenges that the aftermath brought. So looking at the history of public health through the lens of the disaster response and preparedness, you will see some of these ones. Let me go over them again because it's as if I missed a slide. I think so. Let me go back and see. I think I missed a slide. Yes, I didn't finish my pandemic. I apologize for that because I was talking about the Spanish flu, and then I didn't talk about the 2009 influenza pandemic that happened, and it affected people in 214 countries, causing almost 19,000 confirmed deaths. That was influenza. And then you remember polio. This was a very key one I almost left out. Polio was a common and highly feared disease that caused severe illnesses, including paralysis and death among thousands of people each year. If you look around your environment, you would remember how you would realize the havoc that polio has caused. And when the vaccines were introduced in 1955, thousands of people lined up to take the vaccine. And an initiative to eradicate polio was launched in 1988. And because of that initiative, in more than 125 countries, the outbreak of polio has been curbed. Even today, we have polio. Just I think WHO declared that polio had been eradicated. You know, even countries in sub-Saharan Africa like Nigeria had to key in. There was vaccine resistance in the north because of the conspiracy theories that came up. They want to cut off. They want our children to give birth, or they want to kill people in the north. And some persons said they were not getting the vaccine. But with the increase in uptake of vaccines in recent times, polio has been curbed in many countries. I think it was only recently that there was a little upheaval in the cases again, which is receiving attention. Or you talk about HIV and AIDS. HIV and AIDS. During the 1980s, the human immunodeficiency virus, or HIV, emerged, and it spread rapidly across the globe. But public health has responded to this pandemic by developing new ways to diagnose and treat those who are infected. Newer modalities, the Bill and Melinda Gates Foundation, they brought initiatives to some sub-Saharan Africa of free testing. Oh, go and get tested. You don't need to pay anything. Now, when you are tested, you are able to access antiretroviral drugs free of charge. And there was this promotion of the prevention of mother-to-child transmission. And with all those initiatives, new infections of HIV are now down to 20% over the past 10 years, which is a sign that public health interventions are successful. Talk about the COVID-19 pandemic. which started in December 2019 in Wuhan, China. Now, we have all experienced this, and we have looked at the way that public health agencies responded swiftly to the pandemic of COVID-19. Now we can list the interventions. First, there were the guidelines. Oh, these are the guidelines. You must have what we call social distances. You must maintain a distance of 1 to 2 meters from the other person to avoid the having droplets coming from the individual on you and transmit the infection. You have to wash your hands, or if you cannot access hand washing quickly, you can sanitize your hand with alcohol-based hand sanitizers. And then there were travel restrictions. If you must come to this country, you must have a PCR negative test of not less than of not more than 72 hours before you come. Oh, if you are not got this, don't come to our country. And then came vaccinations. Vaccines came out. Moderna came out with their vaccine. Pfizer came out with their own vaccine. Johnson and Johnson came out. Even in Africa, the COVAX was formed, which is a coalition to make sure that vaccine is available to Africans. And some of the companies and even governments of the world were donating vaccines into the coalition. They were distributing them among countries to make sure that people are vaccinated against the scourge of COVID-19. And even then, conspiracy theories came out. Oh, there is a microchip in the vaccine. No, if you take it, that is 666. If you take it, you are not going to have this. If you take this, you are going to be dead in 2 years. Oh, this one, the site is now having some magnetic properties. The site now lights a bulb, all sorts of stories, as it has always happened to public health interventions that border on taking vaccines. But the public health efforts are prevailing. Now, new variants come out. The Alpha came out, the Beta came out, the Delta came out, the Omicron is out now. And already people are also talking about the next one, which is about coming out. But with all those things, public health officials are at work and trying to get countermeasures against them, including increasing the efficacy of the vaccines, either by taking booster shots or by taking even the third or fourth dose of the vaccine. So looking at the lens of the pandemics, you see how public health has worked through the different pandemics in history. The Spanish flu of 1918, the influenza pandemic of 2009, the polio outbreak, the HIV scourge of 80s, the COVID-19 since 2019. And now we can legitimately move to the next slide, even though I've discussed some things there. The next lens is the disaster response and preparedness. Over the years, we have seen how that is a third area. We have seen how public health officials have been very, very responsive to disaster occurrences, and how they have also always been prepared to respond to the disaster. As we are talking now, there are public health agents that are responsible for surveillances. They are putting surveillance on weather, they are putting surveillance on food importation, they are putting surveillance on even the quality of air, the air that we breathe, they are putting surveillance on the water we take, in fact, on every area, to make sure that we are prepared to respond to whatever is coming. Bill Gates keep talking about being prepared for the next pandemic. That is a public health measure, and that is how to stay prepared, to stay making sure that the capacity to respond swiftly to whatever is the next big thing that comes is not left to chance. It is done deliberately, it is done intentionally, and it is done with the right resources. And I've already explained biological weapons. I've talked about earthquakes and hurricanes, volcanic eruptions, and the tsunamis. So let's look at the last lens, which is prevention and policy. We have a lot of policies that have been developed over the years to respond to public health problems. Like I mentioned earlier, in 1500 before Christ, the book of Leviticus, which is the third book of the Hebrew Bible, is believed to be the first written health code in the world. So we can take the book of Leviticus as a health policy, as a health code, as a preventive document. Now, you also look at environmental protection laws that have been promulgated over the years. You look at things like the Basel Convention, you look at even the recent ones. Right from the earliest times, there have been conventions that have been ratified to make sure that people in different countries are putting in cooperative efforts to ensure that issues of public health concern or occurrences that have an impact on public health are curtailed. In environmental health, for example, a lot of conventions have been ratified. There have been conventions on climate change. There have been conventions on the generation of greenhouse gases. There have been conventions of reducing the hydrofluorocarbons that have been sucked into the air. And recently, you can see that I think that was late last year, we still had a convention on climate change where many countries came and pledged their support to support the cause of reducing the greenhouse gases that are portending damage to the ozone layer and increasing global warming around the world. What about the laws against tobacco and alcohol consumption? I am sure that you would know the simplest one in your city, in your country. You see labels on cigarette packs and see something like tobacco smoking is dangerous to health. Or some persons will say smokers are liable to die young. Those are messages, those are, let's say, counseling bits that have been put around by public health officials to deter people from consuming tobacco and alcohol. In fact, in some adverts of alcohol, they talk about you must be above 18 for you to be able to access the content of the bottle, meaning that you must be an adult and you must be able to decide for yourself whether it is good for you to go for that destructive substance or not. Those are examples of public health interventions over history. What about food manipulation and handling laws? We have laws guiding abattoirs. We have laws that are guiding the kind of food that is given, like in school health program, for example. We have public health officials who ensure if you are going to cook for these children, you must give them a balanced diet. This is the mix that you are going to be having in their plates. That is a public health intervention. And even the handling. Oh, you can't serve bread with bare hands. You have to put on your hand gloves. If you're a chef, you are into pastries, or you are in the restaurant, you have to cover your hair. You don't need to leave your hair open so we don't find a strand of hair in the food. You're not going to leave your mouth area and your nose open, because when you breathe and you talk, there are droplets that are coming from your nostrils, from your mouth to the food. So you must wear face masks. Those are food handling and manipulation laws. What about drug use laws? Oh no, you can't use hard drugs. You can't use these harmful substances. No, we can't allow you to bring cocaine into our country. If you decide to bring cocaine into our country, the penalty will be death. That is using the police powers of the state to mitigate against bringing harmful substances that can get people addicted and that can destroy mental health. You have other laws like saying, oh, this organization, this body is responsible for making sure that the quality of the kind of drugs that we take to treat diseases and ailments in the country is ensured. So we set up this body, and the body comes and says, this is what should be done from now on. That's a kind of policy, and that's preventive measure. Oh, we have pharmacovigilance. Let's keep an eye on the kind of drugs that people consume. If you take any drug and you have any adverse reaction, oh, please report that. And then talking about the quality, every facility, maybe a hospital, every hospital must have a unit for testing the drug that they are giving to patients. If you have a drug coming in, for example, you have something like ampiclos, which is ampicillin and clavulanic acid, you bring it, test it. Let's see the quantity of ampicillin in that drug. Is it up to 250 milligram as stipulated? And the clavulanic acid, is it up to the 250 milligram? Begin to them together to 500. You must test them. Those are examples, and these have happened over the years. Now, when we talk about public health this way, we talk about history this way, you will be wondering in your mind, what is the difference between the healthcare system that we know and the public health system? And that brings us to another point that we shall consider in this lecture today. That is clinical and public health care. And you can also call it clinical medicine or public health. Now, note this. When we talk about clinical care or clinical medicine, clinical care is focused on the individual patient. And clinical care or clinical medicine is concerned with diagnosing and treating diseases in individual patients. I am sick. I go to sit down with a doctor. The doctor takes the history of what is wrong with me and he diagnoses what is wrong and he tries to give me some prescription. That is clinical medicine. It has evolved from the earliest times when we had a medical doctor and then a nurse, just medical and nursing care. It now involves a highly complex team of professionals where you can have physiotherapists, you can have other oral healthcare professionals, you can have nutritionists and dietitians, you can have medical imaging scientists, you can have medical laboratory scientists, and very, very highly complex team of professionals. But one thing you need to note in clinical medicine is that it is concerned or focused with treating the individual patient. But on the other hand, public health, which you can also refer to as population medicine, focuses on populations. Public health focuses on population. So it is focus is on groups of people rather than just an individual. So whenever you hear public health, remember populations. The population could be the whole world. It can be people in a particular region. It can be people in a particular district. And it can be people in a school. It can be a group of persons, but that is population, not individualistic. So clinical medicine, individual patient. Public health, populations. But you need to know before we leave this issue that clinical care or clinical medicine and public health or population medicine are complementary. It is important that people in public health and people in clinical medicine work collaboratively to protect and promote the health of the public. Now, before we go ahead, let's look at the key differences between the two. What are the key differences between clinical and public health? Let's look at them. Now, I've put them in graphical form. I don't know if you are seeing them well, but let me get them out. Now, in clinical medicine, clinical sciences are essential to professional training. There must be anatomy. So anatomy is just on its own. There must be physiology, there must be anatomy, there must be this, there must be that, Those are not clinical sciences per se, because you can have them in public health. But when you come to core clinical sciences, like if it is in dentistry, for example, maybe you are talking about a course dealing with exodontia, it comes under clinical medicine. If you are talking about the general medical practice, you talk about a course like pharmacology, a clinical science, because you are going to sit down to be able to prescribe drugs. You must have that clinical experience, you must have that clinical science. But on the other hand, even though you engage in public health care, you engage other sciences like anatomy, like I mentioned, like physiology, you are not going to go into clinical sciences as deeply as the person in clinical medicine goes into. What it means is that the person in public health care, they also have pharmacology, but it's not going into prescription details. It's not going deeply into the pharmacokinetics and pharmacodynamics, dynamic components of pharmacology. Even though the person in public health takes a course like anatomy, it's not going to cadaver. It's not going to try to operate, for example, to look at the quadratus lumborum muscle or to look at the sternocleidomastoid muscle. It has nothing to do with that. But the person in clinical medicine, maybe a dental surgeon in training, who is going to be administering some interventions around the head and neck region, would have to go to cadaver, would have to open up the sternocleidomastoid muscle, for example, to take a look at the structure and in order to prepare for what to do in future. So number two, in clinical medicine, there's diagnosis and treatment emphasis. You have to diagnose and you have to treat. But in public health medicine or population medicine, there is prevention or public health emphasis. Now, let's run through these ones. Clinical medicine, individual patient focus. Public health care, population focus. Then joint laboratory and patient involvement in clinical medicine. Laboratory and patient involvement. You are managing the patient. You need to send the patient to the laboratory. Now, the doctor in the ophthalmology can send the patient in. The other doctor that is just in chemical pathology can send the patient in. Joint laboratory, patient involvement. The laboratory revolves around diagnosing what is wrong with the patient. But in public health care, there is a joint laboratory, but what we have is the field involvement. You are not sending individual patients there. If there is an individual, you have taken a sample to send to a public health laboratory, it is because you are perceiving what is happening to the person as a health to the public. It is because what is happening to the person has public health implications, public health concern. That is why you want to investigate in order to prevent the spread of that. And then in clinical medicine, there must be history taken. You take a history of current illness, what is wrong with you, when did it start, what are the symptoms that you have. You direct your questions to the patient. But in public health care, what we do is we identify the problem. We identify the anecdotes, the parameters that are present in the population. And then we can even use focus groups. We can focus on groups, and then basic population health indicators are there. We also take a look at them. We can get them from records. We can get them from our surveillance data. And then in clinical medicine, there is review of symptoms. You look at the symptom. What are you having? I have headache. I have malaise. I feel nauseated. But in public health medicine, there is surveillance statistics. We talk about disease registries. As someone had an Ebola viral disease research in the area, then it is registered in the registry. And then the surveillance statistics, those are things we look at. We're not looking at symptoms, you know. And then in clinical medicine, there's physical examination of the patient. You're looking at the patient. Oh, you look pale. Oh, I can see that you are in obvious respiratory distress. But in public health care, we look at behavioral risk studies. What is the risk of adolescents? Adolescents who are engaging in unprotected sex. You know, if we know that people in a community are engaging in so much unprotected sex, we know that there's the behavioral risk factor for the contraction of HIV. And then we also do observational studies, cross-sectional studies, and case control studies in order to better understand the situation as opposed to what obtains in clinical practice. And then in clinical medicine, we develop a single or differential diagnosis, but in public healthcare, we develop a hypothesis which we need to get tested. In clinical medicine, we conduct tests to confirm the diagnosis or reduce the number in the differential, while in public health care, we do case control studies or even prospective cohort studies. In clinical medicine, we evaluate modes of possible treatments using clinical studies to know which one is much more effective. We evaluate modes of possible interventions to know which is much more effective. But in public health, we evaluate mode of treatment by outcome evaluation. You are looking at the outcome evaluation, you are looking at the outcome of what has already been done, what has already been given, what has been administered, intervention that has been given, what is the outcome. Now, in this area, people are having so much malaria and the health center is full of people. And then we come into the community, we distribute insecticide treated bed nets, and then we take statistics after about a month, and then we compare the baseline data we had before the distribution of the nets to the data we now have after giving the nets for a month, and then we look at the outcome of it. Has malaria been prevented? Are there fewer cases reporting to the health center? And from there we can draw a conclusion. And then we also look at cost benefit analysis. What is the cost of this intervention? What benefit does it give? When we put the cost and benefit together, we analyze them. How does that come? That is health economics. And then we treat the problem in clinical medicine, whereas in public health medicine, we select, we modify, and we implement programs. We implement programs, not just treating problems. Implement programs that would stay and take care of the problem that we have identified in the community. Oh, there's problem of tuberculosis in this community. If we go to clinical, the clinical says, okay, let's treat these people. But in public health, we say, okay, let's set up a tobacco control program that can have a lot of components. There's a component of educating the people about what to do to avoid tuberculosis. There's a component of telling people what to do after they have contracted tuberculosis to make sure that the health of the community in which they live is protected. In clinical medicine, we adjust treatment plan as necessary, while in public health medicine, we revise programs as necessary. As we set up benchmarks and we monitor programs, we are able to revise the programs as necessary. Last but not the least, the ethic in clinical care is personal service ethic to the person, individualized, while in public health, we have the public health ethic, which is population centered, a population centered ethic. Now, before we go ahead, let's look at the determinants of health. There are factors that determine health, how healthy we are. I just want to run through the factors here. The factors are 5. The first one is genetics, genetic composition, and this talks about genes and biology. You know, your age, your gender, your genetic makeup. There are factors that affect health. Number 2 is behavior, you know, attitudes and practices. Your behaviors, human behaviors like smoking, like eating habits, like physical activities, they can determine health. The next one is environment and physical influences. This one talks about the total ecology. It talks about the air, quality of air, the water you drink, sanitation quality, the whole environment of man. And the next one is medical care, which is the clinical interventions, the quality of healthcare that you receive. Someone gets sick in a community, how accessible is the nearest health center? and what is the quality of the health that is there. There are many persons who became sick in the past. If they had got help early, they will have been saved. They will have been alive and with us today. But because they couldn't get help early, they died, or their health deteriorated, or the health became debilitating. The condition became debilitating because of health factors. And then the next one, we talk about social factors. When we talk about social factors here, it goes beyond just relating to people. It also includes culture. It includes belief system of a people. It includes the economic socio-economic factors, or economic factors like what you do for a living and how much you earn. As we continue in the public health discourse, you will understand that all these 5 determinants have roles to play on the health of people. Now, let's take a look at the health impact pyramid. Now, this pyramid was taken from the framework for public health action published in the American Journal of Public Health in 2010. The pyramid illustrates the impact of different types of public health interventions. Now, let's take a look at this thing now. Let's take a look at the pyramid. Now, when you take a look at them, take a look at the different sides separately. Look at the side in orange. Is that orange or yellow? And then look at the other side in white, but written in blue. And then let's take a look at them from the top down. The first one on the right-hand side is counseling and education. And counseling and education takes place in clinical or other settings. Now, what is an example of that? Tobacco warning labels are promoting quitting, like I said before. Tobacco smoking is dangerous to health. Smokers are liable to die young. That's an example of that. And then look at that first one, the counseling there and education that we talked about. When we look at it critically, it is very good, it's of great essence, but it is not as effective as we would like that to be. There are times when counseling and education are the only forms of intervention available. And when we apply them consistently and repeatedly, we can have an impact on the health of the people that we are targeting. However, it is not the most effective. Like we talked about warning labels on cigarettes. People have those labels there and they still go to get their tobacco to use. Now, the next one, it talks about medical care. That one is clinical intervention. Like if one has a heart problem, for example, cardiovascular disease, the interventions can have a considerable effect. But we are limited by a lack of access to certain patients who need care, and they lack adherence to medical instructions in the real world. Someone has high blood pressure, which is a cardiovascular problem. It comes to the clinic and you are telling the person, for example, if you prescribe nifedipine and you say, this nifedipine, make sure you take it on empty stomach. And when you are on it, don't take grape juice, because it can increase it can produce, it can be toxic to it can make the active ingredient available to tissues, and it can be cytotoxic. How do you know that people are going to adhere to the instructions? Or you have somebody who is almost having a heart attack and you say, please, when you get home, just rest, make sure you don't do anything. And this individual comes home, he has children, he has people, he's shouting around and he's not resting. That's medical intervention. And then the next one is preventive medicine. Preventive medicine, like vaccinations, like the vaccination we have for COVID-19 now, like the cholesterol screening that we have. That's the next one. Intervention can have a lifelong effect. There are vaccines that you take just once in a lifetime and the effect lasts a lifetime. There are some you take periodically and they greatly improve the quality of life. And the next one is making healthy decisions. Healthy decisions. Now, like, oh, I just need to use my seat belt. In some countries, people are not even ready to do that, except that law enforcement agents come in to force them. And law enforcement agents are like saying, oh, we are government. We can't allow you to kill yourself. We're going to remain here together. And they penalize you for not wearing the seatbelt. But those seatbelts are healthy decisions to make, or even smoking restrictions. Oh, you can't smoke here. This is a public place. If you want to smoke, please go to your house and smoke, or go to a private place, so that we can avoid this secondary smoke where people stay around smokers and they inhale the cigarette smokes. And we are told by research that the person who smokes secondarily that way has worse effects of the tobacco than even the person that is smoking. So we try to keep them from public places. And at the base of the pyramid, you have the most important one, socio-economic factors, like you want to give people education. Oh, we want people to go to school. When people go to school, they are able to take better actions. They are able to take responsibilities for their own health. We want to reduce poverty so that people are able to access the interventions they should access. These ones improve quality of life by helping people out of those situations, helping people out of poverty, providing basic sanitation. This is what government should be doing, improving access to education, and making sure people have healthy food. Now, let's take another look at the pyramid again. Look at the arrows that are pointing out. On the right-hand side, you have increasing individual effort needed. Look at where the arrow is pointing. And then if you look at the left-hand side, you have increasing public health impact. What it means is that increasing individual effort at the socioeconomic level, which is the biggest, the greatest impact, you have people not putting in too much effort at the individual level. They are not putting so much effort because government is doing something. Government is establishing an outfit to carry out sanitation, and then they are forcing them. They are using the police powers of the state. You must bring that to us. We must pack them away. Because of that, people do some of those things very easily. And then even making healthy decisions, not as much as that, because the police powers of the state are there. If you smoke here, you are arrested. If you don't wear your seatbelt, you are going to penalize you. And then the preventive medicine, you can make vaccines compulsory, like the childhood vaccines. Oh, your child is born, your child just has to take. In fact, if you do not have yellow fever vaccination, don't come into our country. You must have hepatitis B vaccination before you come. You must have COVID-19 vaccine before you come into our country. Those enforcement parameters and those police powers of the state are helping people to comply with that. But when it comes to counseling and education, that the onus rests on the person who received the counseling, who received the education to take actions. We see that there's a need to increase the effort at adhering to those instructions on the side of the individual, because nobody is doing it for them. But on the other side, you see increasing public health impact. The impact of the first one, you see, is very low. Tobacco warning Ontario, just write them there. You don't do anything about that. You come to treatment of heart disease, the individual that is concerned can only take actions. All you need to do, you give the education, you enlighten people in the community, the individual takes action. But the greatest of the public health impact is felt at that base where you have socioeconomic factors, because government or authorities or non-governmental organizations can directly affect, reduce poverty, and can provide education. Learning outcomes. Now, today, you would now have learned that there are conceptual and working definitions for health. And number two, you would also have learned that public health aims to provide maximum benefit for the largest number of people. In fact, that is the mission of public health. Number three, there are five main dimensions of health: the physical, the social, the mental, the spiritual, and the emotional. And there are five major determinants of health. Number five, clinical health care focuses on the individual patient, while public health care focuses on the population. And last but not the least, that the history of public health is as old as civilization and can be viewed from all perspectives. Thank you for listening.